In this video today, I'm going to go over the most common aftermath health issues after HG. So if that is the video you're looking for, then stay tuned. And if it's not, ta-ta for now. In no particular order, number one, decayed teeth. This is the worst. It starts with your teeth chipping, and then it will chip, they'll crumble, and they'll even get mushy, like a banana. It's so disgusting. And I remember just every day I woke up to my teeth just disintegrating in front of me at an alarming rate too. And it was one thing that my smile was the one thing that I always got complimented on. And it was the one thing that hurt the most to lose. And even though I got dentures now and I've had bone grafting and I have implants on the bottom, still it's not my real teeth. And I'm still reminded every day about Hyperemesis Gravidarum. Even though I'm 15 years in the aftermath of HG, it still feels like yesterday. There's not a day that goes by that I don't remember it. And losing your teeth is a big one. Huge. The one thing that I hated the most, I could tell you, was it was either assumed I had poor hygiene or I was a drug addict. And I'm sure if you dealt with that, comment down below, because it's hard to deal with that. It's hard to prove, no, this is from my pregnancy, from vomiting. And they're thinking you're a drug addict, or they think you don't shower, and you're trying to get that validation because you need that validation like so much. So I understand you.
You are validated.
I talked about in part 1 about mast cell activation syndrome, aka disorder. It's used interchangeably. And cell activations, when your body causes constant allergic reactions and you react to things that normal people don't react to. Like I react to my head turning, I react to moving my hands, to the door opening, to the light turning on. It's very aggressive. And even though I'm getting treatment and I have IV medications and I'm getting immunoglobulin therapy, which has helped tremendously, my treatment is for the dysautonomia, but it's helping my mast cell because dysautonomia and mast cell go together. Different types of dysautonomia. I have more than one. So I have POTS syndrome, posterior orthostatic tachycardia syndrome, and then I have neurogenic syncope, and then full autonomic failure. And this is all from HG. So dysautonomia refers to a group of disorders that affect the autonomic nervous system, which control involuntary bodily functions such as your heart rate, your blood pressure, your digestion, your oxygen, blinking, walking, talking. Even with all those fine motor skills, you have things that are all automatic. And that is what dysautonomia controls. Now, it's very common for moms to get both a form of dysautonomia in the aftermath of HG and common to get mast cell issues where they're just thinking they're having a histamine reaction. Because when mine first started, I didn't know what was wrong with me. And I'll never forget this one girl. She helped me so much with getting on my ass every day about what I ate, what I took into my mouth, even what water I soaked my dentures in. And I'll always be grateful to her. Always. Brain fog. This is one of my biggest aftermath issues, I would say, because to me it affects everything. I call it brain switching. What I mean by brain switching is 1 minute you're fine, and the next minute you feel like you were thrown in a gas chamber and you're under the influence of drugs, even though you're not. And then you get stuck in that feeling of feeling doped up, like on drugs, but you're not doped up on drugs. That brain fog affects everything from my cognitive function to walking, to talking, to having a conversation, to recording this video. Like, I get it, and it will come in spurts, like I have it right now. But I'm still trying to just get through this video. And what's common with that is brain trauma. Now, there's different types of brain trauma. You know, the most common, I would say, are mental health issues such as
Post-traumatic stress disorder from your pregnancy from HG.
depression, anxiety, postpartum depression, postpartum psychosis. And if you don't know what postpartum psychosis is, because I get this a lot, I have a blog on it and I'll link it below, but I do need to make a video on it because it's not talked about a lot. But it happens with HG moms quite often. You can have trouble eating, weight gain or weight loss, swallowing issues, cyclic vomiting syndrome, that's just like HG, but you're not pregnant. Gastroparesis, slow emptying of your stomach, fibromyalgia, which is chronic pain over your whole entire body, nausea, like everyday nausea. It sucks to always be nauseous, always. I have a G tube, and so Robert pushes my meds through my tube. I can't take them by mouth because I have trouble swallowing, and I either choke, the difficulty swallowing, I throw up, or I get a reaction. And so it's just easier to have a G tube to push my meds straight in, and then I get them at a quicker rate. That helps my body break them down because I have gastroparesis, the slow emptying of your stomach. Gastro is stomach, paresis means paralyzed, so your stomach is paralyzed. And I don't have the J. I used to have a GJ and do feeds in the J, but I was having too many problems and my GI didn't want to listen to me because I advocated for myself. So they pretty much refused to see me anymore. So then my husband and I just decided to keep the G tube. And as long as I could keep some weight on, not have to go on TPN. And then if I had to go on TPN for a while, that I would. And then I'd get a feeding tube if my weight got back down to a certain point. So that's one thing, like, it's important to have a plan. This is not a full list of everything. So you can write down in the comments below if there's certain aftermath issues that you have that you want to share to help the community, because I can't sit here and list every single one. I may have it and not list it, but every mom is different. Every HG pregnancy is different. Every aftermath is different, but there's always some things that are the same. And that's important to remember. There's a huge chunk of us that have all the same health issues, and it's just not a coincidence. No, it's what HG does to you. Also want to mention TMJ, the TN face pain. I can't pronounce it right, but I have it. Trigeminal neuralgia. They used to call it the suicide disease because the pain from the TN pain is so painful and so electrocuting that you get on your face. Some people only get it on one side. Some people get it on both. I get it on both, but it's more common, I believe, on one side. Malnutrition is huge. Anemia, thiamine deficiency, B1 deficiency, kidney failure, stroke, seizures, your esophagus rupturing, blood clot issues, having blood clots, pulmonary embolism, your lung collapsing, you got the post-traumatic stress, you can end up with sepsis, a lot of fungal infections. Vitamin deficiencies, though, are really common. The most common are B12, B1, iron, B9. I'm trying to remember this off the top of my head. And I know there's some other ones that are common, so you can drop it down below. What are the complications of hyperemesis gravidarum to our children, to our babies that go through this with us? Over half the children exposed to HG in utero will have neurodevelopmental delays like ADHD, sensory process disorder, autism, sleep issues,
Behavior issues, big time.
having like GERD, acid reflux. There's so many things that happen to our children because they go through this with us, and they always say, oh, your babies are strong, they make it out great. Not always. And that's something that's really important to know, that if you are having issues with your child, regardless of what the issue is, and you feel it's related to your pregnancy, you need to get answers. You have to remember, nobody's going to advocate for you. Nobody's going to advocate for your child but you. And you have to be that voice. You have to be that advocate, because nobody else is going to save your ass but you saving your own ass. So remember that. I tell you this because I want you to be able to get the help. I want you to be able to not have to go through what Robert and I have gone through the past 15 years. And we've been through a lot. The aftermath has even taken a toll on him. Like, I haven't done a video on that yet of how it affects your caretakers, but I'm working on it. If you guys have any questions, or I mentioned one that you're definitely struggling with, please put it below. If there's something that I did not list, please also put it in the comments so I can readdress it in another video if I need it. Alright, so this is Starr and Strong HGactivist, and I hope you enjoyed my video. Make sure to follow me and subscribe, and I'll see you guys in the next video. Ta-ta for now. Bye.